I'd like to tell you about a patient that I met recently named Terry. Terry worked at a lawyer's office in Hamilton, and she was really self-conscious about her smile because she was working with clients at the legal office all day. Terry had recently had a tooth removed by another dentist, and then she came to see me to talk about her smile. I asked her why she was talking to me about this problem and not to the dentist who had just removed her tooth about a week ago. She told me that there was no problem removing the tooth. It was actually a very pleasant visit, but she felt like that dentist just didn't have a plan and wasn't really interested in coming up with a plan. That dentist, to her, seemed like he just saw a broken tooth and wanted to remove that broken tooth. Whereas Terry wanted to talk more about, well, how does this affect the rest of my teeth? And if I do this, is that going to change the options that I have for fixing my smile? And what other options do I have? Are there other things that we can do besides removing this tooth? So she had the tooth removed. She saw one of our ads on Facebook promising no lectures, no judgment, no pressure. She liked what we had to say in the ad, and she came to see us. I took some time getting to know Terry, asking her lots of questions about what she's been through in the past and what she's hoping for things to look and feel like in the future. And what I began to understand is the most important thing to Terry is that we had some sort of long-term plan. She did not have a lot of money to spend. She was really conscious of spending her money in the right areas at the right time. She didn't want to waste steps or waste money. And I really understood what she was saying because we have so many patients that are in the same boat. It also became clear to me that Terry was really concerned about the rest of her teeth, not just the one that had just been removed. She had a couple of teeth that were really black from some old metal fillings, and that was the main thing that was bothering her. And she was a little bit upset because her other dentist didn't even bother to find out what she wanted to do with her smile or what the most important things were to her. Terry's main goal was making sure that her smile looked and felt healthy again. After doing an exam, talking with Terry, and coming up with some options, I presented her with a range of solutions. I told her that fixing her problem the way that she wants could cost her anywhere from $5,000 to $50,000, which is a really, really wide range. She told me that while the $50,000 solution sounded really good, realistically her budget was closer to $10,000. So it took some creative solutions, it took some payment plans, it also took some phasing the treatment so that we took care of the most important things to her first, and then we delayed the less important things until later. But we found a solution that works for her. And that's really the core of what we do here at Smiling Dental. We want to understand what you've been through, what's important to you, what your priorities are, and then come up with some creative solutions to make sure that you get the smile that you want.